Allowing patients to choose where they get health care is the Americanization of Canada's health system.
This is a common myth. Every OECD country, other than the United States, seeks to provide universal health care for its population. The US is an anomaly among our Western allies, and no country is trying to emulate their system. But likewise, no countries are trying to emulate Canada's system. We're also an anomaly in that we're the only OECD country that prohibits patients from purchasing their own health insurance. And we're also the only country that prohibits physicians from practicing in both the government system and in independent private surgical facilities. When trying to improve their own healthcare systems, none of our Western allies even contemplate a ban on private insurance or on private surgical facilities. Rather than making our system more like the United States, we should aspire to make our system more like our other Western allies, allies who perform better at providing health care.
It is unfair to permit some patients to obtain more timely care through access to non-government hospitals. It will mostly benefit the wealthy.
Allowing increased choice in how patients access health care would actually improve equity, so this claim is false. Ensuring that everyone suffers equally is not a morally or legally compelling justification for prohibiting patients from choosing how to access health care, especially when the current government system isn't meeting the needs of patients who are suffering on wait lists. And when it comes to our charter rights, health outcomes, which are protected under Section 70 guarantee of life, liberty, and security of person, rank higher than hypothetical equity concerns. And when it comes to equity, it's a fact that Canada consistently ranks among the lowest in terms of overall equity of our healthcare system. So when critics talk about preserving equity in the current system, they're misinformed because there isn't much equity to protect.
If we allow patients to choose independent care, physicians will abandon the government system.
This is also a myth. The independent healthcare system won't deprive the government system of physicians because the government system rations healthcare. Specialist physicians don't get enough operating room time in the government system for them to fully use their diagnostic and surgical skills, and some don't even get enough operating time to even maintain those skills. Many diagnostic and surgical specialists seek hospital privileges, but are denied because of a lack of resources. The BC situation gives us no evidence that allowing patients to choose where to get surgery done will lead to fewer physicians in the government system. And even though there's no evidence of harm to the government system, any harm that could hypothetically develop in the future can be addressed through narrowly tailored legislation. For example, by requiring physicians to perform a minimum number of surgeries in the government system before they can move to the private system.
When healthcare is supplied by for-profit centers, the quality will be lower than when it is provided by the government.
This is a myth. There's been no issue with the quality of diagnostic and surgical services in independent clinics in BC that have existed since 1996. There's empirical evidence that independent clinics provide care that's at least as good as, or in some cases better than, the quality of care in the government system. The argument also doesn't really make sense because the same physicians operate in both systems. And the government system in BC actually contracts with the private surgery system, so it's all the same thing. And in any event, the quality of healthcare in Canada is really highly regulated, so the quality of care at both systems shouldn't really be an issue.
Allowing patients to choose independent care will result in increased costs overall.
The first assumption is that healthcare wages in the government system will be driven up as the government will need to compete with higher paying private surgical clinics. This isn't necessarily true. The main driver of healthcare wages is the overall supply of physicians, nurses, and technicians, and that supply is controlled by the government. In BC, when there have been shortages of healthcare workers, it's been because the government has decided to restrict training in order to lower costs. BC has not seen a shortage of healthcare workers as a result of the independent clinics that have been open since 1996. However, the province has seen shortages as a result of the government restricting training and operating time. The government isn't required by our Constitution to spend more money on healthcare. But if they choose to ration care in the government system, they can't turn around and prohibit patients from protecting their health by going outside of that system.